pleasure to be here in Lethbridge today. Just want to note that we are gathered here today on Blackfoot territory, and I acknowledge the Métis people who share a deep connection with this land. I'm David Shepherd, Alberta NDP Health Critic for Primary and Rural Care, and I'm joined here today by my friend and colleague Shannon Phillips, our Finance Critic for Pensions and Insurance and the MLA for Lethbridge-West. Now, this week we saw Danielle Smith unleash another wave of chaos into our healthcare system. There's a lot to unpack, but there's one thing that comes through clearly. There was nothing announced this past week that will provide any new doctors or nurses or paramedics or healthcare aides, not one new frontline healthcare worker in this UCP plan. None at all. That's fundamentally what's wrong with this plan. Danielle Smith doesn't seem to care about the basic, fundamental problem, which is a catastrophic shortage of frontline healthcare workers in Alberta. Instead of investing in patient care, the UCP is embarking on a massive expansion of government bureaucracy. Over the next 2 years, they plan to establish 14 brand new government agencies, boards, councils, centers, and secretariats. None of that is going to make decision-making faster or closer to home. Instead, it's going to create more chaos in our clinics and hospitals. The UCP plan is going to make healthcare harder to find and slower to get. And for what that means for everyone here in Lethbridge, I'd like to pass things over to Shannon.
Well, thank you, David, and thank you for your now years of advocacy on behalf of folks' access to primary care. That is something that has been really, really important to folks here in Lethbridge as we've lost our access to primary care. And I know that your advocacy has made a difference in the small strides of improvements that we've actually been able to win, and it's because of voices like yours in the legislature, so thank you. The shortages that David is talking about with respect to frontline workers are, of course, a serious problem for ordinary people here. You can't find a family doctor accepting new patients. It's very difficult across the province, and it's certainly well nigh on impossible here in Lethbridge. We have fewer doctors in Lethbridge today than we did 3 years ago. I know of many people who rely on regular prescriptions who have to keep trying their luck with a walk-in clinic or a telehealth app. This is not normal for a city of 100,000 people with a major hospital and a university and a college. We are barely replacing the doctors and nurses who are retiring or moving out of the province. And I really worry that this latest radical upheaval will drive more folks to look at early retirement or a different province, or not coming here entirely. Now, during the election, we heard from ordinary people here that we need a new clinic and we need to train health professionals here in Lethbridge so that they will stay. We care about those things here in the Alberta NDP. So that's why we said over and over again that if elected, we would set up such a clinic, we would fund it, and we would use our strengths here in Lethbridge, our university, our college, our surrounding Indigenous communities, the AHS South Zone, to get it done. We were not focused on tearing anything down, but on delivering the frontline care that people need. And people told me on the doorstep and via my email and telephone calls and just walking down the street, people would come up to me and still do every day to tell me about the shortage of primary care here in Lethbridge. But with Danielle Smith's UCP plan to bulldoze the whole healthcare system and replace it with 14 different steps of bureaucracy, there will be no new clinic. Everyone's plans are on hold while we start this 2-year bureaucratic nightmare. Meanwhile, no new doctors or nurses training to meet the needs of this city and surrounding communities. We saw Danielle Smith present the glossy version of this scheme on Wednesday, but the day before we released the entire plan because it was leaked to us. So Albertans can look under the hood and find some big problems right away. The UCP's own internal analysis, not the sanitized version that was given to us by the Premier, describes some of the plan's enormous risks. Those include fragmentation of care and service disruptions and service failure. Healthcare is a matter of life and death. So when we're making decisions, if a risk is flagged to us of service failure, that means people will suffer. They are massive risks. This new wave of UCP health care chaos comes when our clinics and hospitals are already terribly strained. We don't need a plan for new bureaucracy. We need a plan to get more healthcare workers to the front lines today and into the future. We need more healthcare workers, period, and there's none of that in this UCP plan. It's as simple as that. Thank you, and David and I are now pleased to take your questions.
Yeah, I think I would have a question here for David. David, we've seen a lot of issues with staffing in rural areas here, and especially you look at Milk River constantly with the closures. Just what would it take to get these rural clinics the proper staffing they need to just keep, just to stay open?
Well, the first thing we need is stability in the system. And what we've unfortunately seen over the last 4.5 years is just utter chaos and indeed antagonism, attacks on doctors and frontline healthcare workers from the UCP government. So that's largely what drove doctors out of practice and out of our province and has created the massive deficit that we're now trying to fill. So when we have this proposal now from the UCP government to create even further chaos, what I'm hearing from healthcare professionals, from people that know the system, is that this could just simply drive even more doctors away. It's certainly going to make it even more difficult for us to recruit. So what we need is a real plan from this government. We've seen jurisdictions like the province of BC, others in Canada, who have made real investments, frontline dollars, to stabilize family doctor practices, to improve their pay. The UCP government spent most of the last 3 years fighting with doctors, ostensibly talking about a new payment system, but making no progress because of their own antagonism and incompetence. And now we have Minister LaGrange, who has spent the last 6 months crafting how to create more bureaucracy in the system and taking no concrete action, not one more dollar into that front line. So what do we need to be able to recruit to rural areas? We need a government taking real action now, actual investment, actual dollars into frontline resources, not just talking about it. Secondly, we need to do, and I will recognize that this is in motion, and I will give the government credit for a proper decision here, investment in more training in rural areas. So certainly the program being developed at the University of Lethbridge in collaboration with the University of Calgary is an excellent step. When we train rural professionals, when we train medical professionals in rural settings, they are more likely to stay and work in rural settings. Thirdly, we need to be providing more support for these rural health professionals. Doctors can't work alone. So your family doctor, your OBGYN, the folks that we need to attract here also need to know that there's going to be an anesthesiologist on call and available when they need to do that surgery or when they need to do a cesarean. They need to know that we're going to have the nurses that are needed to provide the support in the hospitals and the clinics. So we need to create a functioning ecosystem. But what we don't see, we have not seen that from the UCP government. We have seen disruption, we have seen chaos, and unfortunately it looks like we're going to see more.
Yeah, mine too.
Go ahead, Christian.
No, that was my question too.
I don't know, do you have anything to add on that, sort of Lethbridge specific?
No, I mean, just we also saw some empty promises during the election around extension of cardiac care here in Lethbridge. And we made specific commitments to ensure that we would have the highest level cardiac care, an ability to do interventions in emergency situations here in Lethbridge. It's called a catheterization lab, but there's other cardiac services that are required here. We haven't heard a peep from this government since they got elected. They made a sort of system. Now you're going to make a whole new bureaucracy and put walls up between those systems, and not allow the South Zone to be able to do the kinds of integration and sort of systems coordination that is required for cardiac care patients. You're going to end up with more service gaps, and you're not going to be able to move forward on the kinds of new investments and infrastructure and equipment, and most importantly, healthcare professionals that you need to be able to deliver those services. So I see us, because we are engaging in so much more chaos, us going backwards, especially overriding all of the work that the South Zone has done to make sure that our regional needs are met. As far as I understand, Zones are no longer going to exist. Healthcare is no longer going to be moved, needs are not going to be moved forward through that zone system, through that system that is based on geography. Where does that leave us here in Southern Alberta when we've already seen so many things that have affected us differently than the rest of the province?
When it comes to those walls that you're talking about that will create more barriers for, care, where does that leave maternity and OBGYN and all that stuff that we're still lacking in Lethbridge?
Well, that's a really good question, and it's another area where it's not just the acute care system that takes care of women's health and reproductive health, and it's not just the primary care system. There's a lot of overlap, and it's not just about being able to deliver a baby. It's also, as women get older, there are other issues that require the intervention of an OBGYN, and those wait times are incredibly long for things like a hysterectomy or other interventions. I heard from women on the doorstep in Lethbridge-West over and over again that they could. The woman that I talked to on her doorstep over in Copperwood, who had been waiting over 26 months in crazy pain because she required a hysterectomy. How's that going to help her? I don't imagine 14 different sets of new bureaucrats is what she needs. What she needs is primary care and the acute care system to be there for her with the kinds of specialists that she needs in a timely way.
Do one more pass for questions? And seeing none, that's all for today. Thanks, folks.
Thank you.
Thank you.